We are continuing with the Spiderman package. We have the notes here. Anybody comes a little later and they are looking for notes, guide them, they come and pick it up. But they should not come in the middle, go on the sides and get it. So we were on page number 7, and we finished some of the things with OB yesterday before we left. And I'm on page number 7, where it says, after the baby is breathed, in the middle of your page, and it says about the ventilator. Now, something with the ventilator alarm system. Now, when you have patients on a ventilator, and if there is a question, your ventilator goes on with high alarm. Page number 7, ventilators, high alarm. That means there is something you can fix it. Keep that in mind. That means there is an obstruction. There is a secretion. Maybe there is a kink. And patient is coughing. What would be the sign? Gagging, biting. That means you can fix it. Maybe suction, remove the kink, maybe check the tubing. When there is a low pressure alarm, that means you cannot fix and you have to change the ventilator. Simple word. But it says here disconnection. That means there's something in the ventilator, disconnection, or there's a leakage in the ventilator. And what do your patient would have? At the end it says spontaneous stopping the breathing. Patient is going to stop breathing. So what do we need to do when there is a low pressure alarm? You need to change the whole ventilator. But before you change, what do we have to do? Put the embu back. Everyone is okay? High pressure alarm means you can fix it. You can suction, you can check the tubing. Low pressure alarm means you have to change the ventilator. There is something wrong. There may be a leakage. There may be a disconnection. And if you don't fix it, patient would stop spontaneous breathing. So keep that simple in mind. High pressure, we can fix it. Low pressure, we have to change. Now the next thing is hyperglycemia word. When we are seeing in diabetic patient, hyperglycemia, hypoglycemia. Hyperglycemia, sugar is high. Body is going to be hot and dry. Cold and clammy skin is always with hypoglycemia. Now, what is the hyperglycemia means is patient sugar is running very high. Patient can go in DKA. What do you do when patient has hyperglycemia? You have to give insulin or you have to increase the fluids. But what happened with hypoglycemia patient? What do you do? Give them orange juice. Anything with the milk is good. Crackers are good. And what else can you do if patient cannot swallow with hypoglycemia? Glucagon. Remember the word glucagon, injection, because there are patients they cannot swallow, and also you can go for concentrated sugar. Concentrated sugar, you can go around in the lips, in the buccal area, and absorption will take place. And absorption is good. So remember, patient is not able to swallow. Maybe some question you have, put the concentrated sugar in the buccal area. That means for absorption. Or you can give them glucagon. Next is number 2. You move on, ICP and shock. Everyone must know the difference between ICP. Now, ICP, vital sign, the blood pressure is high, and pulse is low, and respiration would be low. In shock, symptoms are opposite. Patient's blood pressure is dropping, and remember the word pulse is high, and respiration is high. Remember the word, what is we call when the pulse is low? Bradycardia. So sometimes they don't give you slow pulse. They're going to use the word bradycardia, tachycardia. When you have bradycardia, that means his patient ICP is up. And when you have tachycardia, is remember I mentioned yesterday, which are the conditions you have shock. Remember the word dehydration question that you're monitoring, and there may be vital sign tachycardia on dehydration. Why? It's a hypovolemic shock. So remember those two words are important. I want you every time to add few wording here. In ICP, I want you to add the word is called pushing tribe word. Cushing triad word is not a Cushing disease, but changing vital sign in patient with ICP. It's a sign of ICP when they're saying, what is a Cushing triad? Cushing triad changes in vital sign. So add on ICP side Cushing triad. What is in Cushing triad are increasing systolic pressure, blood pressure, and decreasing diastolic blood pressure, and also you have decreasing pulse and decreasing respiration. Same vital sign here. But I want one thing everyone remember, not only remembering in ICP changing blood pressure, but what is changing in the blood pressure is increasing systolic and decreasing diastolic. And what is the word is called? Cushing triad. I want you to add some more vital sign in ICP so you remember every time the ICP questions are Cushing triad word and positive Babinski reflex. Babinski reflex positive. Usually Babinski reflex disappear in the babies at age 1. After age 1, any time is positive, there is a sign of ICP. So remember, positive Babinski reflex. Also decorticate and decerebrate is position changes. We all know what is decorticate. Decorticate 2 words and they become very stiff. Decerebrate, the hands are away. Sometimes they don't use question, decorticate, decerebrate, because they become stiff and they use the word postural changes. So remember the word postural because they are very stiff and that is the postural word changes. So everyone is okay? I added few things in ICP questions are, we all know level of consciousness. We talked about that yesterday. I added the word Cushing triad. Everyone need to remember what is a Cushing triad. You will see them in ICP. Increasing systolic and decreasing diastolic. Pulse is low, respiration is low. The next thing I said, positive Babinski reflex. Somebody had a head injury and you're monitoring Babinski. If they're saying is positive Babinski, that means the patient ICP is up. And what else we said? Decorticate and decerebrate. Everyone is okay? And those are ICP questions are. Add every time in your notes more so you memorize more. Everyone is okay? Cushing triad word, where do you see them? In ICP patients are. Now number 3, I will move on. The word is core pulmonary. Very important word. What is core pulmonary? The heart is affected. And which patient the heart is affected? It says in the side is right side heart failure caused by underlying left ventricular failure. So if you have a cardiac problem and left ventricular failure is leading to also right side heart failure. So when we are using the word right side heart failure is called the word core pulmonary. That means the lungs and heart are affected. And which patient you will see that caused by left ventricular failure. Also, I want you to add here, very important for NCLEX question are COPD patient. As I will move on, COPD patient, what is a common complication with COPD patient are core pulmonary. So remember, whenever we are reading any question, complication of what is a core pulmonary, that means the right side heart is failure. Which patient you will see as a complication when you have left side heart failure and also when you have is called pulmonary with COPD patient. So what is the complication of COPD patients are is called pulmonary, and another complication, write down the word here, pulmonary edema. Pulmonary edema. What is the sign of pulmonary edema? I want you to add here pink frothy sputum. Pink frothy sputum. So patient has a COPD. What are the 2 complications I added here is cor pulmonary. What is the meaning cor pulmonary? The right side of the heart is damaged. Pulmonary edema means they have fluid more and patient is having pink frothy sputum. Whenever you have in your question and they are giving you pink frothy sputum, it's a sign of pulmonary edema. What do you do as a nurse? Notify, because it's serious. So what do you do? Not to keep monitoring, always notify if you have RN or MD. So we need to notify. So everyone is okay. Cor pulmonary is the word is right side heart failure and left ventricular failure, and also patient with cor pulmonary you will see in COPD patient. So when I'm going to talk about COPD, I'll repeat again, but I want everyone to remember COPD is very important. We have a lot of patients with COPD. So COPD complications are cor pulmonary and pulmonary edema. Next is number 4 is with the drug. Heroin withdrawal, irritability, poor sucking. That's a side effect. Number 5, juice, no meat and milk together. That's a question as culture question. Number 6, brachial pulse. You must check when you're giving CPR in the infant. So highlight the word CPR. Infant, what pulse do you check? Brachial pulse. Test for lead poisoning. Lead poisoning is important and you must monitor lead poisoning around 12 months of age. And what does it can lead to lead poisoning? Is paralysis, lead to blindness, lead to mental retardation. If any question on lead poisoning, how do you treat them, the child with lead poisoning, the word is called chelation therapy. Write down the word. How do you remove that? Chelation therapy. Your poisoning, when you have too much of poisons or too much of toxicity, they use the word chelation therapy. So you got to remove the toxicity. In chelation therapy, the name of the drugs, I will write down here, EDTA, and number 2 is BAL, B-A-L. At least something you should know. And chelation therapy, lead poisoning, children must be screened for the poisoning, and it does cause a lot of side effect in the babies, so we must screen them. Number 8, potassium. When you have low potassium, remember I said everyone must know your electrolytes, your lab, and if you have low potassium, what food can you give? Some of the foods you have here, bananas, potatoes, citrus fruit, and potassium. Anyone who, when you're going very closer to exam, make sure you start looking what food you are giving for all your electrolytes. I gave a package yesterday. You do have a lot of diets in there. You do have in my electrolytes chapter when I gave it to you guys. So make sure you start knowing your electrolytes. Must know normal sodium and potassium. Number 11, when we are talking about culture, before you start antibiotic, you need to do the culture. I want to go over culture word, culture and sensitivity. What culture and sensitivity we are going to do for your patient? Number 1, you can do, if they have pneumonia, you're going to do sputum. Patient has UTI, you're going to do urine. Patient has wound infection, you're going to do wound culture. If there's no drainage, then you're going to do is the blood culture. So remember, you can also do the blood culture and they will know what infection the patient has in the blood. And when do you do? When do you collect urine specimen sputum? Before you start antibiotic. Why do you do the culture in your question? Number 1 is your answer. You're checking sensitivity. Now, what is the meaning sensitivity? Patient asks you why the doctor has ordered to give me a Bactrim or penicillin. The meaning is when you do culture and your result comes back, in the lab result, it will say there are 2 sections. R is resistant, sensitive. You have list of drugs here, resistant. You have list of drugs here, sensitive. So Bactrim is sensitive, and that's why the doctor has ordered the Bactrim. So a patient is asking, why the doctor has ordered this medication, your answer is going to be because the bacteria is sensitive to this medication. Everyone is okay? And we do the culture and sensitivity. And why do we do it? The culture, to start appropriate treatment. Because if you don't do culture and you're giving medication and that medication is resistant. So for example, I give you a question. They give you, you are taking a medication, doctor started Bactrim, but lab result came and patient has Bactrim resistant. You got to notify immediately. It's not going to work. Doctor is going to change the medication and they're going to put it something with the sensitivity. Everyone is okay? So we know all your culture and sensitivity must be done. Let's move on, page number 8. On page number 8, with leukemia, highlight the word leukemia. And leukemia means is what? Bone marrow. And so write down on the top, patient has leukemia. And here, monitor for epistaxis. What is epistaxis? Is the bleeding disorder. And why? Because the platelet count is low. But not only platelet count is low, what is in leukemia would be, is patient would have is bone marrow problem. Another question can be, with leukemia, monitor for red blood cell, white blood cell, and the platelet. What is the word is called when the platelet is low? Thrombocytopenia. Everyone remember that word. So simply you know the wording. Patient is admitted with leukemia. Not only you're monitoring the bleeding problem, but you're looking all the cells in the bone marrow is affected. Number 13, best way to keep the babies warm is to keep them a skin contact covered. Very important is the newborn babies are maintaining their temperature. Now, those who have attended OB with me, and in OB, there are few words, and I want you to add here, because we must know this wording they're using. Number 1, evaporation. Evaporation means is, the word is keep the baby wrapped with blanket. Wrap the baby with the blanket or however, because evaporation lower the temperature. So they're using this word in the exam. So what is evaporation word is? Cover the baby with a blanket, keep them covered. And number 2 is word is radiation. What is the meaning? Radiation, away from cold surface. Away from cold surface. Anything warm, close, babies are away from cold surface. Like walls are closed, don't be closer, but the surface area is closed. So they give the word evaporation, radiation word, and also conduction word. Conduction word means is padded surface area. Padded surface area, or where do you keep the baby? In simple word, write down, you put something. You're going to weigh the baby, and you keep on the baby's scale without any paper, without anything there. That means the baby is getting cold surface. So the meaning is cover the surface area. That means write down the word when you're weighing patient, giving bath, or cleaning them, don't put them on a without anything. If you put them any without, and they give the question, somebody is doing the weight of the baby and there's nothing on the surface, how does the baby lose their heat? Or by conduction. See, these are the wording they may use in the exam, and they've been using it. So we must know evaporation, radiation, and conduction. The fourth one is convection. convection. Prevent from cold draft, coming outside, a cold draft avoided. So very important, maintaining babies temperature, and how do you maintain baby's temperature are by different things we are using. And what are we are here, I added here, those who have done OB, you have in OB note, but I want you to write it down here. So you're not going back, but at least you won't forget the wording, evaporation word, radiation word, conduction word, and convection word are. Next is number 14. In number 14, on page number 8, we are on page number 8, number 14, patient comes in active labor. Underline the word active labor. That means mother is in labor. What do you check the first thing? First thing, we always check the fetal heart rate because you want to be sure the baby is okay. So what do we check here? Fetal heart rate. So everyone, this goes with evaporation, radiation, conduction, and convection by keeping the babies warm by different method. Number 15, very important, in mental health question. What is the word is called here on page number 8 is phobia. What is the meaning? Phobia here is systemic desensitization. What is the phobia means? Person is afraid. How do you remove their fear? By desensitization. That means is removing the fear by therapy, by talking. So what answer you will give if your patient has phobia and mental health? Your answer would be the treatment is what? Systemic desensitization. Removing the fear before you force a person to go out or do something because, and what is phobia is in mental health? This is a mental health question. I want you to write down phobia is neurosis, is not psychosis. And what is phobia means is nervousness. People are afraid. It goes their nervousness. Maybe cause phobia by depression. Some people are depressed, some people are afraid, and they don't want to go outside the world. And the question is, your patient has phobia, how do you treat them? So what is your answer? Systemic desensitization. That's a treatment. That meaning is, what is the meaning desensitization? Removing the fear from your patient. Now, I won't read 1 and 2. You guys can read it. Just some suggestion here. Auscultation. The first one, basically, it says, how do you do your assessment? And we all know is auscultation, palpation, and by looking. Number 3, I will go over. On page number 8 is number 3 is amputation question. Now I'm going to talk all amputation. You guys can add few wording here, and if you know, that would be good. We all should know. It says number 3 and number 4. Number 3 is with lower amputation, patient is placed in position. Now, number 3 is about amputation. So everyone knows there are 2 kinds of amputation. We call below knee amputation, above knee amputation. Both of them, patient come back after amputation, your position is going to be elevate, only for 24 to 48 hours. And elevate the foot of the bed. Don't use the pillow word. Don't put the pillow under the knee because it cuts off the circulation. So elevation is okay. Only for 24 to 48 hours. After that, you're going in prone position. So make sure amputation position is prone. And why do you put them in prone position? To prevent is flexion. That's an important word. What are you preventing here? Flexion. What is the meaning? Flexion, bending. So what happened? This is called flexion, your hand, when you bend them. But patient has no leg. And if you keep them up, this thigh area is going to be flexion. So what is the word is flexion? Is this part. You don't want their legs are going up like this. You want them to be in a proper positioning. So what position do you put them here? Prone position. Next thing I want everyone to know, what is the risk for patient with amputation are, is number 1, bleeding. So what do you keep in the room? Tourniquet. Because there risk for bleeding, and everyone should know you are keeping tourniquet. And what else you should have in the room on patient's bed? Trapeze. Very important, so they can move around. firm mattress, so they can lay on there, and positioning is good. And what else would you monitor for your patient here is number one, bleeding. And hemorrhage is one of the complication is, so you keep in the room is the tourniquet. What is number two problem with your patient with phantom or complications is phantom pain. I want everyone to know for phantom pain, what is non-therapeutic treatment. So make sure you guys write down the word non-therapeutic treatment for amputation patient. Non-therapeutic, no drugs in there. And what is no drugs we are using here is called the TENS unit. What are we using here? TENS unit. So make sure when they ask you what are we using here, non-therapeutic, no pain medication, and TENS unit. How does the TENS unit work? It's blocking the pain center. And what do you monitor when you have TENS unit? It's on the skin. They applied like a small unit. It stimulates the nerve, a skin area irritation. You can move that to the certain area. So what do you monitor? Patient has a TENS unit, irritation of the skin. And also, I want you to add, a patient has a pacemaker, you cannot use it because it will interfere with the pacemaker questions, all right? So a TENS unit, page number 8, we are talking about amputation and phantom pain. Everyone should know the word non-therapeutic treatment. And what are you giving them? TENS unit. Pain is patient is having pain. What is the third complication? These are your complications with amputation are. What is the third one? They're diabetic patient. So what are the risks here? Infection. And what do you monitor? Maybe a wound separation, wound infection, and opening of the suture line. So I would say monitor for wound infection. Because mostly you have diabetic patient. So everyone is okay position, prone position. There are BKA, AKA, both amputation patients are, position would be prone. Everyone should know TENS unit. Everyone, we must know their risk for wound infection. Now, next question is, what would you be teaching your patient if you have below knee amputation? What would you teach as a nurse in your question? So I want you on the side to write down when you have below knee amputation or you teach the patient to prevent flexion. So write down one word is flexion. And what happens flexion? When they're sitting too long in the chair. So what are we teaching patient here? Not to sit too long in the chair. Why? To prevent flexion. They shouldn't be sitting at the edge of the bed. That means if you sit all day, so what happens, there's part of leg is hanging. And if they're sitting, what would happen? This part of the leg is going to go flexion. So what are we preventing is patient is below knee amputation, flexion. What are we teaching here is we are teaching patient here is from prevent them from flexion. And what do you teach the patient here? It's right here. Come on the other side. Yeah. So below knee amputation, what are we teaching here? Flexion. Above knee amputation, what are we preventing patient? Rotation. Write down the word rotation. So write down the word rotation. Everyone should know few wording. See, wording is important, rotation. Above knee, what happened? There's no knee. So what happened with the part of the thigh is moving on both sides. And how do you prevent rotation? Any question? Even your fracture patient, you are preventing is rotation. And what do? You put on the side we call trochanter roll. Everyone should know trochanter roll you are preventing from what? Rotation. So I want you to write down the word. What do you do to prevent rotation? You are using here trochanter roll. You can use pillow. You can use sandbag. But they want to know, as a nurses, we all know trochanter roll. What is a trochanter roll? You're folding the bed sheet or you're folding a blanket lengthwise and you're putting on the side and preventing rotation. Everyone is all right? Below knee, what are we preventing here? Flexion. Above knee, what are we preventing here is rotation. And what are we using here? Trochanter roll. Another questions are, what are you monitoring for your patient with the stump? The area is called the stump area. And what do we do for the stump area? We want the stump area to shrink. And what are we using here? Elastic bandage or ACE bandage. And what do you do as a nurse when you remove the bandages? Make sure we wash it. And you go towards the suture line and massage it and prevent them of what? The skin does not get adhered to the bone. And that's why you go towards the suture line. Everyone should know you want the stump to shrink so it will fit in the prosthesis. And that would be later on, but we got to start teaching the patient. Everyone is okay. If you know that much amputation, that's main answers on amputation questions are. Number 3, page number 8, amputation. Number 4, anytime you are feeding patient, whether it's a GI problem, whether nausea and vomiting, you never start with a large food. Patient has COPD. I want you to write down there for small feeding, very important in your question. They will say for COPD patient has poor appetite. How do you feed COPD patient? Your answer is small and frequent feeding. Why? Because of hypoxia. And when you have hypoxia, lack of your oxygenation, you get tired easily. So whether it's a GI, whether it's a breathing problem, how do you feed your patient? Your bad answers are always good. So remember, add their COPD. You will never forget. The first answer for your COPD patients are feed them with what? Small and frequent meals. So all your feeding, any patient with GI, you have GERD patient or you have patient with dumping syndrome, is always small frequent feeding a good answer. Next is number 5, assessment is important. Any questions you're taking, answering, assess your patient. Don't jump and do the treatment. If there is a pain question, what do you do? Patient is complaining pain, give pain medication. No. You've got to assess. You got to get up and check what is the best answer. Where is the pain? When does the pain started? How does the pain is patient is feeling? And where is the pain? Maybe patient has a pain in a catheter area. So always assess in your question. Teaching, continue teaching. We have all NCLEX question are teaching question because we deal with the patients, and teaching you start every day and ongoing until your patient is going home, and your CNA. Meds. We are nurses, but you give medication. Do you only give medication or you evaluate your medication is working or not working? Whether you are giving insulin, whether you are giving Lasix, but if patient's blood sugar is running high, are you going to just keep going and giving that medication, or you will let the doctor know is how much patient is not responding or how is it working? And then you will go on, as unstable patient cannot be delegated. Delegation questions, you're going to get a lot, and we are nurses, we will delegate. And remember the word UAP word, everybody remember UAP, unassisted personnel. Now they're using MA, medication assistant, they can pass the pills, but everyone who is responsible, if you have a UAP, and CNA, and you have MA, medication aid or assistant. Any questions you have, always teach them. Always when you give assignment, make sure they understand, and you teach them continually to make sure your work is done correct. Because if they make a mistake, who is responsible? Again, us. So we have to do proper delegation. Now, CNA can feed, UAP can feed. But if you have CNA and UAP patient has dysphagia, can you give them to feed? No. Licensed person. if your patient, can they do INO? Yes, they can do INO. But what is the meaning INO? They can empty, they can tell you, but who is legally responsible to complete your INO with the doctor's order? In the final INOs are the licensed person. But they can empty the bag, they can tell you what is total INO, but you are supervising and you are completing everything. Same thing in delegation question is what is very important is LVN to take, same thing, a stable patient. Patient comes in, admission, patient is assessing, RN can help you. Patient comes in after surgery, let the RN take care. Patient who has been there for 10 years with hip fracture, you can take it. And they have another question, patient is returning from new G-tube insertion. Your RN can take it. Why? Because it's the assessment and follow through new order. So keep everything in mind because your exam is all your critical thinking. So it's important that we assess. Next is number 6 is LVN cannot handle the blood. It's not handle, but you cannot give. You can be supervising. Remember the word, you can be with RN. You can. 2 people must check the blood before you give because of safety. Your patient must be your name, the grouping of the blood must be checked. But what do you monitor? Remember, 2% to check your blood. Patient's blood, the grouping, and the right patient, right time you're giving. And when you're giving blood, monitor for reaction. What are the signs of blood reaction are? What are the signs of blood reaction? The first is, we all know, there are other signs, but everyone reaction means first anaphylactic reaction and airway, number 1. And if you don't have that, then you move on, and what does the patient has? Rashes, urticaria, and patient complains nausea, vomiting, low blood pressure, dyspnea, and low back pain. Very important, everyone should know back pain. Why? Because it affects the kidneys and it's affecting hemoglobin and reacting and is affecting the pain. So where is the pain? Low back pain, kidney. And what do you monitor is the vital sign right away and you stop the blood. What do we start here? Normal saline. And change the tubing. Make sure you change all the tubing. Start normal saline. Everyone, we must know anaphylactic reaction. Second, we know they're going in low blood pressure. Rashes, you know, breathing problem patient would have, but low back pain. Everyone, because it affects reaction. And then you collect the urine specimen and send it to the lab because they want to see how the kidneys are functioning. Next is number 7, very important. Number 7 is aminoglycosides. What is aminoglycosides? Are the antibiotics we are giving, like vancomycin. That means ending word is, I want you to write down the word mycin or sin word. So remember, any drugs you're going with mycin and sin are medication you're giving for your patient with the aminoglycoside. These are antibiotic. And in the NCLEX or any exam, sometimes they may not use the word aminoglycosides and they give you, doctor has ordered garamycin, same medication, vancomycin. What is the ending word? Everyone remember? Sin word. And what does it affect? Everyone should know. Where does it affect? Is kidney. And what is the word is for kidneys are nephrotoxicity. So everyone knows the word nephro. Whenever you see the word nephrotoxicity, means the kidney. And ear affected means hearing and is called ototoxicity. So everyone should know. And there may be not any side effect. And they give you the question. Patient has been given garamycin and doctor has ordered the lab. See how your labs are important in exam are, and they give you a lot of lab. And there may be your creatinine level is high. Remember what did we said? It affects the kidney. So what lab are you going to see and report it is the creatinine level. So everyone make sure for kidney, you are monitoring BUN and creatinine. Ototoxicity may be after patient finish or before, and in between check the hearing test. Everyone should know. So aminoglucoside medications are, ending word are myosin, and myosin word or sin word are all your antibiotic comes under the group of aminoglucosides. And then you monitor for vancomycin and this. And I want you to add, there's two more wording, is they do the blood test. And what is the blood test they check is called the word peak and trough. Everyone, TROUGH, trough. Peak means after antibiotic dose, after antibiotic. So you are giving antibiotic, after your antibiotic finish, 30 minutes later, they will draw the blood. And they might say, after third dose of your medication. So any of the dose the doctor has ordered. So you finish the antibiotic. As soon as the antibiotic finish, the lab should come within 30 minutes and they draw the blood. And what are we checking here? Peak time. So what is peak means? After. Trough means before you start antibiotic. So simply write down the word before starting. You have to wait. You are going to hang this dose, but now you wait. Before 30 minutes, you will start. The lab need to come and draw the blood. I put it everything together, so it's very important for aminoglucosides. We know they are monitoring for ototoxicity and they're monitoring nephrotoxicity, but also they must do the lab, which is called peak and trough. And peak means after, trough means before. Now number 8, I will move on. Number 8, IV push. The meaning IV push, you take the drug in a syringe and without diluting, you're pushing. So you should not push immediately because your medication is going directly in the vein, and what can happen? Serious side effects. So you take a little time, or you should mix it with the normal saline and it should hang by the pump slowly. Are we clear? So IV push, don't push right away, at least take 2 minutes. If the patient is not a child, the next one, the family option can be ruled out. We all know that. Number 10, in the emergency, patient with greater chance to live are threatened patient or in emergency first who are going to survive, you're going to see. Number 11 is very important wording here. And what is on number 11 are, the word is called ARDS. What is ARDS? Acute Respiratory Distress Syndrome. And DIC is disseminated intravascular coagulation. That's a bleeding disorder. Now what is acute respiratory distress syndrome means are, they both are underlined in the second line, secondary. The meaning is patient did not go respiratory distress if there is nothing going on. That means there's no breathing problem. Patient has acute respiratory distress syndrome is secondary. The meaning is there is no lung problem. Patient has is primary some other problem, such as patient has got burn, patient has sepsis, patient got drowned, some other condition. And what do you, or maybe patient has heart failure, is your MI. And what happened, patient is going into acute respiratory distress. Are we clear? So when your question is in exam, or anytime you're looking, patient is in acute respiratory distress, it doesn't mean the patient had pneumonia, patient had COPD, there's something else going on and patient is not able to breathe. Everyone is okay. Now when we say patient has pneumonia and COPD, we always raise the head. That's your first answer. But in acute respiratory distress, if you have a burn patient, you're not going to raise the head. What are you going to do? extend the neck. If patient got drowned, you're going to put the patient in prone position. It depends what is going on with your patient. What was the problem? And accordingly, either you're raising head or you're turning on the side or you're putting in a prone position, whatever your first reason is. But what do you monitor when your patient has ARDS? I will be go on number 12 and highlight the word. ARDS is hypoxemia. Underline the word. What is acute respiratory distress symptom? Word is hypoxia. Patient is not getting oxygen, or patient has hypoxemia. That means in the blood, very low oxygen saturation. And hypoxemia means very low oxygen saturation patient is going on. And what do you monitor when your patient has hypoxemia? Question are, immediately you should look for ABG. Now pulse oximetry is okay, but when we are saying the word hypoxemia, pulse oximetry is not good to measure that, then you will go for ABG. So remember, is the wording acute respiratory distress mean secondary problem? What is the patient is having a problem in acute respiratory distress? I said the word hypoxemia, and I want you to add there ABG. And what else would be the patient is having a problem when acute respiratory distress syndrome? Or I want you to write down the word, whether it's a children or adult, the word is called retraction. I want you to add there, the word is retraction. What is the meaning? Sometimes they only give you the word retraction. Sometimes they will write a sternal retraction. What is the meaning sternal? This is the sternum is going inward. Second thing is intracostal retraction. Intracostal retraction. The meaning is your muscles between the ribs. And you can see the chest. They're using those muscles to breathe. They are having hard time for breathing. And what are they using here? The muscles. And these are the muscles. When patients are using muscles for breathing, you can see the word is called retraction. Everyone in your question, patient is having retraction, meaning patient is having what? A sternal retraction and costal retraction. Patient is not able to breathe. In the babies, also the word is called nasal flaring. So everyone should know. What is ARDS, acute respiratory distress, is secondary. Not primary, not a lung problem, but patient has patient got burned, maybe patient is going with MI, maybe patient has a renal problem. What happened? Patient is having a problem in breathing. And what do you monitor acute respiratory distress? What are the signs are? Everyone should know the word retraction. And what is the meaning retraction is they're using the muscles to breathe. Normally, if you all are anybody is using our muscles to breathe, mean they're really having a hard time to breathe. And what do you monitor your patient here for hypoxemia? What is the word hypoxemia? You are going to check ABG. Are you going to start oxygen for your patient? Yes, and position. Very important, position and oxygenation. So that is the word is number 11, ARDS. Maybe the fluid is in the alveoli. And patient is, what is alveoli are? Inside the lungs, we have air sac. And those small sac are exchanging oxygen and CO2. If those are filled with the fluid or they are collapsed inside, patient is not going to be able to breathe. So in your question, when you're putting in ventilator, your patient, what is the ventilators are doing? They're opening those alveoli. Are we clear? So we can breathe in and getting oxygenation. Everyone, please make sure we all know the word acute respiratory distress is secondary. Position depends how patient needs it. If they're burned, whatever the condition are. Number 2 word, you remember the word hypoxemia. Third word I said is the word is retraction. They're not able to breathe in. Now what is the word is DIC? Let me go back on number 11, highlight that word. And I said already highlight in 12 is the word ARDS. So let me finish about DIC. What is DIC is disseminated intravascular coagulation. Now this question are important to understand. What is DIC means is, I want write down on the side, bleeding and clotting problem. So patients start bleeding and clotting, and you will see monitor for shock because they're bleeding. So any question come, patient is having DIC. What do you monitor as a nurse? Shock. And why? Because they're bleeding and clotting. Now I want everyone remember in OB question, which patient do you monitor in OB is for bleeding disorder? Number 1, abruptio placenta. When mother is bleeding in abruptio placenta, the blood is staying back. And some of your question can be in OB. Which patient are you going to monitor for DIC? Number 1 is abruptio placenta. Mother is bleeding, not placenta previa, but abruptio placenta because the blood is staying. Number 2, any mother has sepsis. Sepsis can be in your med surg also and can be in OB question. Number 3, amniotic fluid embolism. If you have amniotic fluid embolism, would lead to is bleeding disorder. Number 4 is the fetal death. Baby died in the uterus, fetal death, and stays longer, can lead to. Number 5, liver diseases. Any liver problem, that can also go for med-surg, and mother is also having a liver problem, she can go in bleeding. You must know some answers. The wording and some answer. Everyone, when you see question, patient has DIC, is not primary. Something is going on with your patient, whether it's an OB question or med-surg. Med-surg question, patient has liver problem, patient has sepsis, patient is bleeding, and it lead to DIC. What do you monitor? Sign of shock. Why? Because mother is bleeding. Maybe symptoms are going to be bruising. Maybe ecchymosis word is there. You know patient is bleeding. What do you do as a nurse? Number 1, shock symptom. Number 2, blood transfusion. Maybe IV fluids. And number 3, important medication, heparin. And immediately they got to start IV anticoagulant and helping it. And how do you know your patient is getting better? Another question. How do we assess a patient is getting better? By urine output. If your kidneys are getting enough circulation, your urine output would be 30 ml per hour, which is normal. More than that is good, but at least 30 ml. I'll be clear. So see how you got to start memorizing. ARDS, secondary, DIC, secondary. That means you got to fix both the problem for your patient in order the patient is going to be surviving. So everyone is okay. DIC is disseminated intravascular. All your clotting factor will be abnormal. Blood test, you should do it. Give the blood transfusion, monitor for shock, and give them heparin. After you give heparin, what are we monitoring patient here for urine output and the vital sign? So that covers your some area on ARDS and this. Number 12, we already said the word hypoxemia. Number 13 is your acidosis and alkalosis. Is depending on your pH. I gave you notes yesterday, those who were not here, I will give you guys, and you must know your acidosis, alkalosis, and normal pH level. And how do you maintain pH? What are we monitoring? Are your lungs and the kidney. If your lungs are not changing, your gases, your CO2, O2 level is abnormal, you're not maintaining your acidosis. And second things are kidney. You have renal failure, patient is going metabolic acidosis. So remember, your kidneys and the lungs are maintaining your pH because they're removing from the body all your hydrogen ions and maintaining your acid and base balance. So just two words is important here that you all should know. Number 14, edema. Edema we also has is in interstitial space, not all the time, for cardiovascular space. Now edema means interstitial, fluid shifting. When does your fluid shifting takes place? In your burn patient. What happened in the burn patient? First thing, the fluid is shifting from one compartment to another. And then once you start, fluid is shifting back. And that's why, what do you monitor? When they're shifting the fluid here, you monitor urine output. Very important, Foley catheter. So there are two edema word are. Remember, in your burn questions are. They're going to say shifting of fluid from intravascular to interstitial, and cardiovascular patients are also having CHF. Anybody need the package? Just walk from that side, and on this side we have the package. And next is, I will move on, number 15, weight. Dehydration. How do you monitor dehydration? Is okay, you can monitor dehydration with your patient's INO, but weight is important. What else do you monitor for dehydration? I want you guys quickly write it down, some answers for dehydration. Weight is one. What else do you monitor for your patient is admitted dehydration? Is mucous membrane, right? Number two, fontanelles in the baby will be depressed. Number three, urine output, very important. When you don't pee or you pee more, that means you're losing fluid. So what do you monitor? Mother comes in, what do you ask the mother for the babies? How many diapers has she changed? And patient comes in, ask him, when did he void it last? And the color of the urine is going to be dark because the urine is very much concentrated. Are we clear? So dehydration questions are, remember, and what is your nursing care plan? I mentioned yesterday, deficient fluid volume. That's your care plan for dehydration. Next is, weight is the best indicator. That's one of them you have. Number 16, when your sugar is high, always water is good because water follows. Number 17, aspirin. We tell for the children not to give aspirin. Why? Because it causes Reyes syndrome. If they ask you, what is Reyes syndrome? You already have in the box, it says encephalopathy. It damages the brain and also write down damages the liver. So what are you monitoring? Child who is admitted with encephalopathy is ICP, level of consciousness, liver function test, and check for the liver. So everyone, that's enough to know, is changes in the liver, changes in their brain, and encephalopathy word is good. Next, number 19, cold for acute pain, and like a sprain. Patient had a sprain, apply cold and immobilize. Always remember immobilizing. And next is chronic pain. And if you have chronic pain, rheumatoid arthritis, you can go for heat application. So number 20 is very important for your exam. Number 20 is chronic pain. Patient has a chronic pain. You give pain medication. After 1 hour, patient is requesting other medication. And we use the word guided imaginary. What is guided imaginary? Diverting patient's mind. Maybe by watching TV, reading, listening music, but the word they use, guided imaginary. Everyone should know guided imaginary for pain medication, chronic pain. You're changing before you go into. Patient cannot sleep. Remember, your first intervention should not be the medication. Your first intervention, what can you help your patient? Patient says, I cannot sleep in the night. Don't pick up to call the doctor, get a sleeping pill. That's a very simple answer. So what do you do? Patient cannot sleep. Relaxation technique. Number 2, give them diversional therapy. Let them read books. Let them do something before they're going to sleep. And review. Patient says, I've been doing this for 1-2 weeks and I still cannot sleep. What do? Ask the patient. Review what they're doing. Are they doing correctly or not? So immediate, your first answer, picking up medication, will not be good, whether it's a sleep question or whether it is a question with pain. Relaxation technique, and very important, we use the word guided. In this page, phobic disorder, number 15, everyone should know systemic desensitization, and number 20, chronic pain. Number 21, is patient is in distress. Medication is rarely a good choice. Would be assessment. Find out the reason. What is the patient problem is. Number 22 is pneumonia. What isolation do we have for pneumonia? Droplet precaution. And droplet precaution, can you put 2 patients together? Droplet, can you put 2 patients together? Yes. Remember, we got to know good isolation. In your droplet, same kind of patients, put them together. Do you need to close the door? No. Door must be open. What is important in droplet? The distance of each patient must be between 3 to 6 feet. So remember that. And what mask are we going to use? A regular surgical mask. So pneumonia. What is pneumonia is? What is pneumonia is? Nosocomial infection. So remember, what is nosocomial? Patient develop. Patient don't come and admit it, most of them with pneumonia. We are not doing good care to our patient and they develop pneumonia. So your questions are going to be teaching questions. How do you prevent pneumonia? How do we prevent pneumonia? Number 1, everyone should know pneumo vaccination. So write down on the side, pneumovax for older patient. Which patient are high risk are for pneumonia would be your older population. And chronic patient. Chronic means who have diabetic, who is asthmatic patient, COPD patient, chronic disease, and children. Those are high-risk people, and you prevent them, especially chronic ill patient, older patients are. And what would you give them? Vaccination. Before, as soon as the season comes, we give flu vaccine and pneumovax vaccination to prevent the pneumonia. And what do you teach for preventing pneumonia are? Is, remember, you all know how do you prevent pneumonia by turning them. What else you will do? Deep breathing exercise. Would you tell your CNA to get up your patient every day? Yes. Laying in a bed, they will develop pneumonia. It's not a good practice, leave your patient in the bed. As much as your patient is sitting up, what is the best position for breathing? Sitting upright. So getting up, turning. What is another thing you remember for preventing pneumonia? Incentive spirometer. And that comes in exam. And they will ask you, how would you teach? How to use it? Incentive spirometer. And which patient? Now they're not going to ask you what is incentive spirometer. Your question may be, patient is admitted and patient has a rib fracture. I'll give you example. Patient has a rib fracture. What is the problem with the rib fracture question here? Is it's very painful and patient don't want to breathe hard. And what will they develop? Pneumonia. What do you give them? Incentive spirometer. Patient comes in with pancreatitis pain. Their risk for developing pneumonia. Patient come back after surgery. They're laying in bed. Patient has a hip fracture. Older patient who's laying in a bed. Remember, risk factors are there. and patient is, you have to assess as a nurse, and that what they're checking are knowledge. So remember, any question, any abdominal bad pain with pancreas, gallbladder, pain is so bad that you don't want to even sit properly. And what happened? You're not expanding the lungs. You're laying in a bed, and laying in a bed after patient came in, you have an old patient and admitted, 80 years old, with hip surgery, and patient is in bed. We didn't get him up, we didn't turn him. What did the patient have here? The bed sore and pneumonia. So what are we preventing here? All our care is going to be prevention. So number one, cough, deep breathing exercise, getting them up, incentive spirometer. Now I want to go over how do you diagnose pneumonia by chest x-ray. Before you start antibiotic, you do culture of sputum. How do you treat pneumonia? By giving CPT. Everyone should know the word CPT. Chest physiotherapy. And what do we give them? Bronchodilator. Before you do CPT, you must give, in your question, bronchodilator. So what do you give before you give CPT? Or before you put a baby who has a pneumonia in a mist tent? Also bronchodilator. So bronchodilator, no matter what you're giving, and you want to loosen up the secretion, you've got to open the lung. So what do we give here is bronchodilator, and we are giving CPT. And we are giving position upright. Antibiotic you're giving. Fluids are number one for your breathing problem. Why? Because fluids will help to loosen up the secretion. In your question, oral hygiene is very important when you're collecting sputum specimen or after you're giving CPT. What do you do after you finish? And there may be answer to document, position, and answer is your oral hygiene. That's number one priority. Hand washing is number one priority. Simple answer, but you don't wash hand and you go from one patient to another. What are we doing? We are spreading the infection. So everyone, pneumonia, if you remember all these answers, you'll be good. You can answer your question. Let me finish this page, then we'll take a break. 23, antibiotic. Everyone should know. Antibiotic, before you start any medication, check for allergies, and especially for penicillin. What group of the drug contains penicillin? Cephalosporin. I want everyone to write down the word cephalosporin, like Keflex. Lot of different medication has penicillin, is called cephalosporin. So make sure we all know. And there may be a question. Doctor has ordered cephalosporin. And what do you check before you give? Penicillin. Penicillin allergies are bad. Patient can go in respiratory failure. And before you give, check the allergies. Before you are going to get the doctor's order, always check. Doctor has already ordered, you check patient's allergies. Number 24, pulmonary. Underline the word we said, right side heart failure. I already said emphysema is your COPD. Number 25, COPD is chronic, pneumonia is acute. So what is your chronic COPD are? Emphysema and asthma and bronchitis, three of them. COPD, number 26, you give them oxygen and only 1 to 2 liter. And what breathing do you tell them? Everyone remember I said earlier 2 complications for emphysema patient or COPD patients are, one is called pulmonary, second is pulmonary edema. What was the sign of pulmonary edema? Pink frothy sputum. I want to finish on COPD. Few things is here. On COPD, I want you to write down what is the sign of COPD patient are. How do you know patient has chronic obstructive pulmonary disease? Number 1, clubbing of finger. Make sure we write down clubbing of finger. And second thing, we all remember barrel chest. Barrel chest, clubbing of finger, and how do they breathe? And remember the word orthopenic position. What is orthopenic position? They are sitting and resting on the table. That means they don't want to sit up because they can't breathe. And so they like to sit in orthopenic position. Everyone is okay? Barrel chest, clapping of finger, orthopenic position. And also, I want you to write down the word, they're losing a lot of weight. Why? Because of hypoxia. And I already said, give them small meal. And number 3, they're losing weight. The risk for skin breakdown. And they may give you 3 diagnoses. And they will tell you which are the patient are high risk. You have an older patient who has COPD, who's very skinny, and who's sitting all the time. The risk for skin breakdown. Now, simple question, but you got to remember is there. Number 4, I want you to write down when they do X-ray and what do they find in the lungs. In the X-ray, hyperinflation of lungs. Hyperinflation of lungs. Very important. Their lungs are hyperinflated. Are we clear? So when they do X-ray and they use the word on X-ray, the lungs are hyperinflated. What is reducing here? Number 5, reducing vital capacity of the lungs. Lungs capacity is reduced. What is increased here? Residual volume. What is the meaning residual? Whatever they're breathing in, whatever the air is going, residual volume. But that total vital capacity, what a lung should do, cannot function. But these are in your diagnosis questions are. Everyone, clubbing of finger and barrel chest, weight loss problem, and skin care, very important. We have a lot of patients with COPD. And so remember that. Now we already said complication. I want you to add one more thing, is on weight, is small frequent meal you are giving. And increase calories, increase protein, increase vitamin C and fluids. Protein is good. Calories, because anytime they're losing weight, you increase calories. So if you memorize, you're done with COPD question. Now what is COPD questions are? Barrel chest, clubbing of finger, the tidal volume of the lungs have been reduced. And you do monitor as a nurse. Oxygen, you give 1 to 2 liter. What breathing do we teach them? Pursed lip breathing. So let's take a break and then we'll continue the next page. Anybody who was not here yet?